Across India's capital, popular tourist sites are empty. Residents are holed up at home in a desperate attempt to keep the crisis from worsening. A makeshift hospital is being built to help take the pressure off a hospital network drowning in cases. But for millions in Delhi, the damage is done.
I have seen whole family vanishing in this train. I have cremated 5 members of one family.
Jayant Malhotra and his father Tranjeev usually run an electrical wiring service. For over a year, they've provided free cremation services to more than 1,000 desperate families.
Whenever people say to share your experience, I get goosebumps. 9-year-old child dying due to the shortage of oxygen. Pregnant lady dying due to the lack of treatment.
I had to travel 8 hours from Delhi within a blink of a second. I had to call my parents to come pick me up, and it was all...
For stranded Aussies like Sheena Smatter, this is the crisis she cannot escape. She came to India for her grandfather's funeral and for medical treatment.
I'm really worried that, I can possibly get COVID on top of what I already am going through.
So I'm now back in Punjab.
She, like many others, was scheduled to board a Qantas repatriation flight, but kicked off after testing positive in pre-flight quarantine. She was asymptomatic. Her test detected a low viral load. Soon after, it was revealed the testing company wasn't accredited. Sheena, like 11 others kicked off, have since tested negative. She's desperate to get on the first flight available.
To be honest, as you can see, the bags are still packed and I'm waiting for it.
You're all set to go. You've done everything. You've taken every single precaution that you could. I got a test done on Saturday. I was negative. I had been self-isolating from 1 month in advance. It's just horrendous. You feel helpless. You know that there is not even a 1% chance you've got a positive, and this has to be a false result.
Living in Delhi, I can say the speed of this second surge has been nothing short of terrifying. India had beaten the first surge, new infections were low, and the country was not only producing vaccines for its population, but also the world. Triumphalism got in the way of clear-headed concern, and in just a few weeks, it went so horrifically wrong.
India is registering about 350,000 cases every day and 4,200 deaths. So that's a very high daily case and death toll.
Officially, more than 270,000 people have died in India from coronavirus so far. Experts think the real figure could be 5 to 10 times higher.
What our models are saying that we are sort of at the peak number of daily deaths as we speak. Things are going to probably slow down through the month of May and June. But the numbers are so high, it will take a while for the death tolls and the infection numbers to go down.
Steve Rocha runs a not-for-profit in Delhi, which usually focuses on educating poor people. But as government health systems collapse due to the sheer volume of sickness and death, charities like his have tried to fill the gap.
Many of our young people that come from marginalized communities like this community that we live in Palikadam, have really no resort to any fallback system. And the only fallback system here today is really the NGO world that we are part of.
Steve and his team of volunteers check in on residents in this Delhi slum to make sure the most vulnerable have the supplies they need to deal with a pandemic, from food to medicine to oxygen. Many of the tanks were donated by science classrooms in local schools.
We're still in a pandemic where cylinders, oxygen cylinders and ICU beds were available at costs that were well beyond the reach of the poor.
The distribution of loss worldwide, it has not been equal. The poor, I think they have this tension. They don't have the luxury of socially distancing and quarantining. They have to go to work, and in very highly congested areas where infection spreads.
The virus has spread to rural parts of the country where healthcare is poorest. Dr. Matthew Samuel is the managing director of a not-for-profit hospital in the Himalayas. He was instructed a month ago to convert his hospital into a COVID one and now treats 40 COVID patients.
Every 5 minutes I'll get a call. Do you have a bed? Do you have a bed in the ICU? Do you have an oxygen bed? Can you send us a cylinder? And the calls are coming as far as 100 kilometers.
But finding enough beds is an ongoing challenge.
But the difficulty is all patients cannot be admitted. Every day in the emergency, we see about 15 to 20 patients who would need admission, and we can take only about 7 or 8. We have seen 31 deaths in the last 21 days, which is a huge number. Sometimes you feel helpless because in spite of your best efforts, you're not able to save them.
He's even had to treat his own friends.
We actually lost 3 of our people whom we knew personally. They passed away, and that has been quite a challenge.
A world away in their living room, the Mandair family can only watch anxiously at the devastation unfolding in their homeland. Their despair is heightened by the fact that their 4-year-old son, Gurfateh Singh, is stuck in India.
He's kind, he's a very playful, funny guy. And we miss him. Yeah.
Gurfateh went to India with his grandmother in September 2019. He was meant to return to Australia a few months later, but the pandemic hit and he got stuck.
As a migrant parent, we also consider that this is a necessity of our culture and everything, that we send him back to be with the extended family, to know his uncle and aunts and grandmother.
As an unaccompanied minor, Gurfateh can't fly home. After Australia shut its borders, Harjinder considered applying for an exemption to leave his wife and daughter to travel to India to get his son back. But the threat of getting stuck there was just too much of a risk.
My wife is not working, I'm the only sole earner, and I would have no income then to support my family here as well. But also it's jeopardizing the health and safety as well.
Harjinder Singh wants the federal government to come up with a plan for getting minors back to Australia while the travel ban remains in place.
All I want to say is I want to bring him back, and I need some help and advice from the Australian government. I've been a good citizen here. I've been paying taxes and everything like every other citizen do. So I've done my job, my duties, and all I had to do to be a good citizen. Now it's government. They need to step up and help me.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.